hope you can see the slide. Yes. In yesterday's class, where we discussed the three important concepts: how to hydrogenate or reduce organic compounds, which is removal of oxygen entities or adding hydrogen entities. That topic we had already discussed. And we can make carbonyl compounds into corresponding alcohols. Even that topic we had discussed, and we have seen among sodium borohydrate to lithium aluminum hydride, which is stronger reducing agent and which is safer and which is milder. Selectivity versus strength of the reducing agent also we had discussed yesterday. So all these points where we talked, along with that, we had also had two important topics, the one being Dieckmann condensation. So Dieckmann condensation is intramolecular version of Claisen condensation. Particularly, it is well suited for 1,6 and 1,7 diesters, where the beta keto esters are used towards the preparation of substituted cycloalkanones. For example, if you have a diester, OET, along with C double bond OET, C double bond OET. If you add basic sodium ethoxide in ethanol followed by working up with acid, we get a penta coordinated, like for example, a 5-membered ring of cycloalkane, which is substituted. Same way, and also these are beta keto esters. And if you look at this with respect to this, and if you take 1,7 diester, we get 6-membered ring. So we see cyclization. We have taken an aliphatic substance and we are ending up getting an cyclic. Okay, so such question, again, all of you people who ask me what are the important questions, this type of question will be very helpful for 4 marks. If they ask you, write a short note or explain Dieckmann condensation, what you are supposed to write is this, whatever I am showing in this slide. What is Dieckmann condensation? It's an intramolecular version of Claisen condensation. Where it works, okay, it is used to prepare cyclic alkanones. That if you write, then it is fine. So for more updates or more inputs regarding how it is, you need not worry about the mechanism. For 4 marks, if you write these two, it is fine. Okay, or at least if they ask you principal 2 marks and 1 example, top or bottom, if you write, then also it is fine. But naming, all those things are there. You can find those details in your Google Classroom. Okay, it is already included. So this is one set, what we had discussed yesterday. We also talked about a very strained molecule. Okay, hope all of you remember yesterday. We have been showing this model sort of thing, like all of you, okay, like cyclopropane substance we were discussing. It has a lot of strain in the molecule, torsional as well as ring strain, due to which this cyclopropane generally wants to, if it wants to react, it will cleave. Okay, if it cleaves, then it is more stable. So further, what happens? We have taken a note of 2 sets of example. What happens when we add hydrogen bromide or hydrogenate or add chlorine or bromine with respect to iron chloride. Okay, so this should be, bromine in iron bromide and sulfuric acid. If you do, in all the cases, if you take, we get the ring cleavage followed by addition. So what happens? The ring will be cleaved here, and hydrogen, bromine, hydrogen, hydrogen, bromine, bromine, so that the cyclo group will be broken, and accordingly we get the ring opening reactions. this type of question too you can expect for 4 marks or 6 marks. Okay, so if you write 3 reactions, each one 2 marks, and explain about cyclopropane ring strain and other things, then you get complete marks for this. Okay, this is one of the very simple but an important question. Okay. So I hope till this part everyone understood in yesterday's class, and also the necessary handouts are already uploaded in your GCR. Okay, so everyone can have a look into that. Go through that. If you still have any queries, we may discuss. Now, as yesterday only I had pointed out, we shall discuss on, already you must have seen this particular topic in your GCR video lecture. I don't know how many of you have got time to look into that YouTube video which I had placed, I think 1 week back or something like that. Is what exactly is the synthesis of commonly used drug molecules. Many of you already might have studied aspirin and paracetamol in your earlier classes, isn't it? Everyone might have studied. Now, let's discuss about that more. So, what you have for your syllabus? You have what are drugs, introduction and examples, and how to synthesize aspirin and uses, paracetamol and uses. None of the places you have mechanism. So you can expect a 4-mark question on synthesis of aspirin or paracetamol. Any of these followed by uses. For the synthesis 2 marks, uses 2 marks. Okay. So, or if they ask you drugs and synthesis 2 marks, or like that, accordingly you can split the marks and you can answer it accordingly. Now, I'm pretty sure many of you might have already studied. Can someone tell me how do you, or for example, like how do you define drugs, or how aspirin or how paracetamol is being made? Anyone? Because I'm pretty sure many of you might have studied. Anyone in the class? How how do you define drugs, or how do you synthesize aspirin or paracetamol? You must be having, right, in your schools too. Yes, go ahead,
Yes, sir.
Shiva.
Yes, sir.
Yeah.
We had, but I didn't study.
Okay, okay. And but is there anyone in the class who is not aware of aspirin and paracetamol? Can I expect answer yes or no for that? I don't understand. Yeah. Can I think everyone knows, right, about aspirin, paracetamol? At least paracetamol everyone knows, right?
Yes, sir. Yes, sir.
Yes.
Yes, sir.
So everyone at all, right from the childhood even till date, you must have encountered or you must have
It's a
taken.
painkiller for headache.
Yeah, and that's what painkiller or even fever you can reduce all those things. Everyone at right from childhood till date, you must have encountered or you must have taken it. Probably significant amounts. If you combine, I am telling you, like from childhood to till date, at least some I don't want to 50 to 100 grams or something, or at least 50, like that you must have it is already taken and it must have cured it. Okay, let's see. Anyone would like to tell me how they have synthesized aspirin or paracetamol, or shall we go with the topics what we have today? Okay, let's see. Before we introduce, uh, before we move on to aspirin or paracetamol, let us first look at why pharmaceuticals or drugs are very important. The main reason now you or all of you and me are talking virtually, right? Or else we should have, we must have discussed the same lecture in a classroom. Okay, of course with a PowerPoint, but I must be seeing all of your faces. and then I would be telling you this is how paracetamol is being made, and all of you must have even felt this kind of structures. So the importance of pharmaceuticals and the importance of see the how COVID pandemic has made a, a total countries or world like into like dark situation. You can see that is the reason why vaccinations, drugs, okay, which makes the system more again to get back to the normal phase where it was. So it almost took close to 2 years. Still, it is virtual. Many of the places and many parts in the world still are expecting a third wave or whatever. Still, it is a lot of cases are rising. Okay, so you can understand how important the how to tackle pandemics or how to tackle diseases if there is not proper counters or for example not properly handled well, then it goes out of control. That brings us to an important point of calling pharmaceuticals which form the backbone for medical treatment. Now, most of the pharmaceuticals are low molecular weight organic compounds. If I ask what is the um, paracetamol molecular weight, you can this is the molecular formula, and the molecular mass is like 151. Okay, so it is like almost like a glucose, even lower molecular weight. Like it's like few molecules or calcium carbonate. Same thing, you have that kind of weight, but you see the impact it creates. Now, these are the traditional pharmaceutical substances which you can synthesize by direct chemical synthesis. For example, acetaminophen or paracetamol, which has 151, and ketamine, okay, and several, all these kind of, I don't know how many of you have must have heard other drugs too, but these are the different substances, what drug molecules, and this is the corresponding molecular formula, corresponding molecular mass, and for what we use paracetamol, as one of you pointed out, Surya, someone, it can be used to painkiller, analgesic, and some ketamine kind of drugs are used for anesthetic. Okay, and we have anti-hypertensive and antiviral, anti-inflammatory, anti-ulcer. Okay, so it's not that all molecules are doing reducing the fever or reducing the pain, but depending on the type of problem, okay, if you have an ulcer, what we should do, we should take anti-ulcer. Viral infection, so accordingly you take antiviral compounds or uh, drugs. So depending on the therapeutic indication or therapeutic problem what is there, the treatment or the molecule is accordingly designed, which brings us to an important topic called drugs and its important. Now, I'm pretty sure many of you must already be aware of the term like drug, which means how much drug is an absorbed substance which changes physical or physiological function of the body. Okay, so you can see like as soon as you take a, if you have pain in legs or whatever it is, then you take some medicine or a drug, it immediately reduces. Or if there is a swelling, if you take that, it will be reduced or over time it will reduce. Same thing with many terms. Essentially, what is a drug means? As soon as we administer it, we take it, there will be some physical or physiological functions. Then, medicine, any drug, a part of drug which used to cure prevent or treat illness or discomfort. You call it as medicine. Obvious, you all know. Again, this looks very elementary, I think, for I think some of you or even most of you, but still, let us have, because we are most of us or family or in many places, friends will be they will be taking medicines. So we are already seeing them, and whenever you have drug medicine, you can have effects. They will say side effects. If you take one medicine, you will get stomach ache, or if you take this, you get headache. Okay, so there are effects after taking medicine can be beneficial or harmful. And now, how most of you take drugs or how most of you take the medicines is it can be like solid, like tablets, or liquid, syrups, or inhalers, like gas. Okay, so this also seems very familiar to most of you. Now, even when you have, as I told, effects, you can have side effect. And what happens if some medicine is taken overdose? Okay, so such kind of things also, whenever a doctor prescribes or if you are doing a self medication, what happens? Overdosing also you are aware of. And depending on how you administer the medicines, liquids, they are better absorbed into the body. For example, if you take solid powder, it goes inside your body, and then it goes into that human body system, and then it finds after like dissolution, then it goes into wherever the treatment or wherever you want to, there the problem it needs to be addressed. Whereas liquids are very easily absorbed. And in the case of tablet also, you cannot have full paracetamol or complete this one. Okay, so what they do is they take the active ingredient, you can combine with other substance. Okay, I don't know how many of you are aware of like uh, some calcium based tablets. They have some chocolate coating or whatever you name. They'll have some other coatings which makes it more chewable or different taste. Or some tablets also you can see, or you can also see where it is combined with other substance and pressed into round or oval shaped tablets. Okay, now you might be seeing different kinds of shapes of tablets, but this is a general definition. And capsule also, most of you are aware, where the active part means whichever is the most important part of the medicine is stored in a plastic shell, which dissolves slowly into the stomach. So you take the medicine capsule, it goes as capsule. Once it goes into the stomach, it breaks so that active substances slowly comes out. What happens? You might ask, why can't we take the active substance directly? Either it must be very bitter, okay, or when you take that, it can even contaminate, or it can instead of reacting in the parts where you want to uh, react, it can even be stuck at some places where the reaction is not required. Okay, that is the reason why we need to have in tablet form or a capsule form or drops, especially whenever you want the medicine to work at particular place directly, you use drops. Okay, so this is also one set of formats. And you are all aware of terminology like inhalers. Inhalers also, which are the part of medicine, by applying pressure into the lungs, it can be released. And most relatively painful of all those things are injections. Now, which place or how they are injected also is an important aspect. So there are also active material. You want to pass it at one place, so inject. And we also have implants or patches where like bandages and all, where you have an active material, wherever it is antibacterial or antifungal, there you try to make, where you the process happens by adsorption. Okay, it absorbs to the skin and then slowly it will react. Okay, so this terminology for everyone is quite familiar. Okay, you must definitely need not know this, like you must have heard inhalers, injections, implants, all those things you must have heard. Now, depending on like how these drugs are, we can classify the drugs based on their activity, how they chemically activity or what conditions they are used to treat. Okay, so that is because it's a fair classification. We saw now different molecular weights and different formats, how the active material can be transported across. Now we are looking for classification. So coming back to, as most of you are already aware of, allergenics, which means it reduces allergies. Antipyretics means which reduces fever. So paracetamol, aspirin, and all will do this job. So it brings down the temperature. Analgesics, painkillers, okay? Anti-malarial drugs treating malaria, antibiotics. So antibiotics. So you please look at the term anti means it doesn't like bacteria. So it inhibits bacterial growth. Antiseptic. Okay, many of you must have also seen these kind of things where it prevents the germ wounds near the burns. Whenever you fall someplace like that, as soon as you apply one plaster, or as soon as you clean it like Dettol or substance, which that is the reason antiseptics are also very important, which prevents the germ wound, especially at near the burns, cuts or wounds. And there are quite variety of stimulants, anti-anxiety drugs, sedatives, vaccines. Okay? So of course you must really appreciate importance of vaccines, because of which most of us are doing safe or fine. Now, let us come to an important topic what you have on drugs is aspirin. Okay, all of you pay attention. This part you have for your syllabus. Whatever I told you earlier also, this is general introduction before I come to this particular topic. Now, aspirin is the most widely used medication in the world. Okay, so aspirin is acetyl salicylic acid. So you are all aware of salicylic acid, OH, COOH, and that. So this is the structure of aspirin and the formula and what is the composition. Now, how the name aspirin has been derived? The name comes from acetyl spirit, A from acetyl, and spir from spiric acid. Spiric acid is salicylic acid. Okay. So this is the salicylic acid, which everyone might be aware already, hydroxybenzoic acid. What happens in the years 1875, how this was isolated or how this was first found, this is useful, is only salicylic acid and the salts of salicylic acid like sodium salicylate or potassium or whatever, ammonium kind of salicylates were used as a pain relief, or it can reduce even temperatures, and also to treat like rheumatism this drug was used. And what happens, you are taking that also, they are taking active form, like directly active form, because this salicylic acid, it can affect gastrointestinal problems and it has a very bad taste. That is the reason why you see there is an active ingredient is combined or it is kept in a safer or a slightly better uh, like capsule or in the form of tablet, which makes it more easier to be taken. So what happens, they thought it can lead to these problems gastrointestinal along with a bad taste. Still, it was not used that extensively. Somehow it was used to do reduce the fever, pain, all those things. Then lot of chemists they thought that to improvise this salicylic acid by different form, replace H with some alkyl group, H with salts of sodium, ammonium, whatever they keep on trying. During these years, you please look at the years. One such one of the greatest I can say like outcome or a breakthrough in that area is in 1868 to 1946 time. Felix Hoffmann he has made acetyl salicylic acid. He's a German chemist. Okay, so you can see Felix Hoffmann. So he made acetyl salicylic acid. So why he is so bothered about acetyl salicylic acid is he want to he was looking for the substitute of sodium salicylate. Okay, instead of COH, Na you have. His father had arthritis. So in order to treat his father's arthritis, he looked for sodium salicylate substitute and he synthesized acetyl salicylic acid. Okay, there is again aspirin invention discovery, whether to credit to Hoffman or to others. There is still a debate, or there are different countries who would like to take the credit. But let us not go deeper into that. What you people should appreciate is acetyl salicylic acid was found to be very useful after later on. Now, what happens or how this reaction takes place? You synthesize aspirin in acidic conditions. You take salicylic acid and acetic anhydride. You all know acetic acid. Replace COOH or H with acetate group. So acetic anhydride you get two carbonyl, or you can replace one hydrogen with one more acetate group. If you react these things, what happens? One hydrogen will be taking away acetic acid and you get the acetic, so OCOCH3. So we get acetyl salicylic acid and acetic acid will be the byproduct. Okay, so this is the synthesis procedure. Very simple. Okay, you take salicylic acid, acetic anhydride, put them, mix them, you get acetic salicylic acid. Is that aspirin? No. Please look at this reaction carefully. The product also has acetic acid. You cannot take acetic acid directly. So what you do, you want to remove the acetic acid. And remove means remove the acid part and isolate the acetyl salicylic acid. Now, if you look chemically, aspirin is an organic acid because C double bond OH is carboxylic group and an ester group. C double bond CH3. Okay, so C double bond O, you can see this. So it has both organic ester along with an organic acid. Now, how the mechanism? You don't have mechanism for your exam. Okay, if you write this reaction, it is okay. I'm just giving for the students or how it happens, right? You should also be aware how the reaction progresses. If you look at the reaction, you have acetic anhydride. Again, the electron affinity of, or like electron negativity of oxygen will bring the double bond towards itself. Where you have an acid catalyst, it likes to bind with oxygen functionality. So where it forms a bond, and where you are creating a slightly positive charge to the carbon center, which again will react with the hydroxyl group of the salicylic acid. Okay, and we cleave the acetate group using a proton, and then we get acetic acid along with acetyl salicylic acid. So this is very simple mechanism, how it works. Having said that, now let us look into what are the benefits. Okay, what are the benefits of acetyl salicylic acid or aspirin? Aspirin's use can be with respect to analgesic, also antipyretic, and it can also reduce inflammation. Even till today, people use aspirin for various functions. And it also it decreases the chances of heart attack, due to which it is also a blood thinner because of its effect of blood thinner. Again, at normal doses, we cannot take high. Coming to the problems, if you take more doses of aspirin, it can upset stomach. And if you look at since stomach itself will be having a lot of acidic environment, aspirin can diffuse through, because aspirin is already acid and ester group, so it likes to go through the protective mucus lining, which ruptures the cell, and also it creates bleeding if it is taken excess. If the aspirin is taken at overdose. So these are the points of how aspirin is synthesized, and where it is used, and what are the problems. So if they ask you for 6 mark question, the same thing what I had told you about aspirin and paracetamol, you should write merits along with demerits. And it's very simple. You can use it used to treat fever. It used as blood thinner, and demerits are overdoses can lead to stomach upset along with mucus lining rupture and so on. That is very straightforward, I guess, and no mechanism is there. Okay, now let us move on to one more important drug, which is paracetamol. Just I will stop the class by 12:20, so that last 5 minutes we can discuss regarding, or even in the next class also we can discuss regarding the question bank or topics, what kind of questions and so on, and Viva also we would like to discuss. Now, paracetamol is one of the most widely used pain relievers. Okay, I don't think so. Anyone in the class is not aware of paracetamol or even aspirin in that case. So it is acetaminophen. In US and Japan, paracetamol is called acetaminophen. But in rest of the world, along with European countries, it is called paracetamol. If you ask for paracetamol in US or Japan, it is more referred as acetaminophen. So first paracetamol isolation was done by Morse, H.N. Morse, in the year 1878. Again, this also, he is known to be the first one who have synthesized, but unfortunately, after his death, only after its decades of its death, only it was widely used. He made it, he isolated it, he observed some properties, but this became more popular after his death. Now, how do we synthesize paracetamol? By means of Booth's method. I will tell you what exactly is Booth's method. In Booth's method, what we do is, you all are aware of phenol, which is a toxic pollutant, or you all are aware of phenol substance. Phenol, what you do, you can like nitrate the mixture using sulfuric acid and sodium nitrate. We get like we have already discussed this, like nitration reactions. We get ortho and para kind of nitration reactions. Now, look back what we have discussed. We are having isomers, position isomers. One is ortho, one is para. So we are having mixture of two isomers. Now, anyway in the class, can someone tell me how do we um, remove the isomers, these two isomers? If I want to take like nitro group or ortho group, how will you take selectively that? How will we
by
selectively?
using fractional distillation.
Okay, so by using distillation. Now you all know that these things can also have different physical properties. So if you distill, simple logic with respect to distilling, you heat the material. One, one with lower boiling point will condense first, or when you are cooling it, and one with high will go to the next later stage, like standard distillation process, which is used for petroleum industries and so on. So now we get this nitro, ortho, and para. What we take the para one after the distillation, like steam distillation and so on. We take a fractional distillation, especially in this case. Then we take the nitro counterpart, and then we apply our organic chemistry, whatever we have learned in the last class. What we do, we take the para-nitrophenol, add sodium borohydrate. You know that it will supply hydrogen. So nitro group will become amine. So you cannot anyway reduce here. So you are taking amino, we get aminophenol. Then you replace one of the hydrogen with acetic anhydride. So what happens is electrophilic aromatic substitution reaction we can see with respect to the formation of acetaminophen. Okay, so this is how we get paracetamol. This is a reaction, same step what we had discussed in earlier one. The lone pair of electrons of nitrogen will bind to carbon, which is bonded to oxygen group, where we get a slightly positive charge here. And then there is a rearrangement. Okay, you can see this. And then what happens? We are cleaving the acetic, acetic acid we try to get along with the generation of paracetamol. So this is the mechanism of how we produce paracetamol from aminophenol along with acetic anhydride. In both the cases, paracetamol or aspirin, we use acetic anhydride to get paracetamol and acetic acid. So what you are supposed to write in the exam? If you write aminophenol or even this complete steps, you get acetaminophen, that is more than sufficient. Okay, or this with respect to this, if you mix, we get paracetamol and acetic acid, that is also fine. Okay, now what are the advantages? Very, very important point. It is used to treat fever for the people of for people of all the ages. Amitoj, yeah, 1 minute. Yeah, go ahead, Amitoj. You have any doubt?
Sir, tomorrow we have to turn on the camera also.
Yes, yes. Yeah, I will discuss about that. 1 minute. Just give me 1 minute. After that, I will. So, as I told you, the merits of this reactions of this paracetamol is it can treat fever in the people of all the ages, right from an adult to an infant to an very old age people. It can be used to treat, and also it used to relieve the moderate pain, mild to moderate pain. And if you take, of course, paracetamol excess, it can damage liver, bleeding, stomach bleeding, and so on if you take continuously. So these are some advantages, disadvantages of taking paracetamol. Okay, so most of the material what I'm showing you now is adapted from these references. Okay, so have a look into these topics too if you need more inputs. And all I guess for today. And now let us. Is there any doubt with respect to the